Hey, Courtney. Have any of you guys had snow yet? Hey, Chelsea. Nurse. Awesome. Welcome, everybody. Thanks, Joni. Cindy. Oh, femur. Yep. No snow. We haven't had snow yet either. We've been kind of unseasonably warm. I'm going to go ahead and get started because we have a lot to cover in an hour. Thank you if you're just joining us. I'd really love if you would share the organization you work for, the county you work in. It just gives me a good sense of who I'm talking to today. I'm super excited you're here and that you chose to spend an hour of your time with me today. I know we're all busy, so I really, really appreciate it. So I'm very excited to be here. A couple housekeeping things is this is being recorded. So after the webinar, you'll get a recording, you'll get a PDF of the slides, and you'll also get a couple other links that I'll talk through today as well. So expect that email probably tomorrow, potentially, maybe today. So I'll get that sent over to you. I'm going to take my video off for the majority of this presentation, just so there's no additional distractions. I have a couple of videos that I play, so I'll turn it back on at the end. But with that, I'm going to go ahead and get started. First, a big shout out to MiHIA and Covenant Healthcare. It's because of our partnership with them that we're here. I get to talk to you today. I get to talk to you for an hour about this wonderful stillbirth prevention education campaign. We can't do this alone. And so when we have wonderful partners like this with MiHIA and Covenant that understand the importance of stillbirth prevention and education and empowerment, it's just so important. And it's because of them that we're here. It's because of them that you can get free educational materials. We're just so pleased with the partnership, and it's because of what you're learning today. You're going to make this change. You're going to decrease the stillbirth rate in your area because of what you learn. So feel free to ask questions throughout in the chat. I may answer them as we go, but I think it's really important to ask your questions just in case I don't answer them during the presentation. I'll get to them at the end, but I don't want you to forget them. So Joni just quick asked, I just saw this one. So can we share the providers? Absolutely. Like, please feel free to share the recording with anybody that you think would benefit from this. We also have an online CE training, and you can take it for free thanks to our partnership with MiHIA and Covenant. So I'll talk about that later. But the more the merrier, right? The better, we're better together, and that's truly what we believe here. So with no other intro, I wanted to first talk through a couple of things before we share this video. I am actually the program director with Healthy Birthday, which is the nonprofit that created Count the Kicks. And I would just love to know in the chat if you've ever heard of Count the Kicks before. Maybe you've been to a presentation like this before. You could just say yes or no. Maybe you've been to a presentation. If you have, maybe you learned something new today. We have a couple new updates, or perhaps this is your first time, or maybe you've heard about it, but you haven't utilized it. Like you know the name, but you don't know anything else about it. So wherever you fall within that realm, I hope that you walk away feeling confident and knowing what you can say to your expectant parents to prevent preventable stillbirths. So my background is in public health. I've been in public health for about 15 years. I'm super passionate about maternal and child health, especially as it relates to systems level change and empowerment. I love thinking through how you can all integrate this into your workflow. And I want you to be thinking about that as I talk, whether you're a nurse, you're a triage, labor and delivery, you're a home visitor, you're a community-based organization. Think through your interaction with your expectant parents and how you can integrate this in so it becomes second nature and you don't have to think about it. So one of the first things I like to do is start off with this video from Good Morning America. And I share it for a couple different reasons. So one reason is just simply it's a feel-good story. This is about baby Save Ruby, who was saved in 2017 when her mom was using the app and noticed reduced fetal movement and spoke up and spoke to her provider about it, and baby's here, and now she's a wonderful 4 or 5 year old she's a big sister. And so it should bring a smile to your face at the end. But two, I wanted to showcase the importance of storytelling. Anytime you have an opportunity to share this with your expectant parents, to have a video up on a screen in a waiting room, or to share it before a childbirth ed class, you can share these. They're on our YouTube channel, they're on our Facebook channels, because that's what people are going to remember, right? You're going to remember baby Ruby today. You're going to remember baby Nala, who we're going to end with. And when I talk about baby saves, what I mean by that is somebody that was using our app, or somebody that knew about Count the Kicks, whether their provider told them about it, a home visitor, or they saw it in a library and they knew the importance of tracking their baby's movements. And they spoke up because they noticed a change, and baby's here because of it. And so that's what I mean when I talk about baby saves. And you'll hear me say that throughout the presentation. When this aired on Good Morning America in 2017, millions of people saw it. We saw a 3,700% increase in our app downloads in 1 month because of this. So I cannot share enough the importance of storytelling. So please feel free to share this. I also might reference a couple points that the mom says during this presentation, so I always like to share it. So with that, we're going to go ahead and listen to baby Ruby's story.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
I just love that little baby stretch at the end there. It's so cute. Okay, so knowing based off how you guys filled out in the chat of where you're from, your background, what you do, I don't think I need to read this slide verbatim, but what I wanted to really point out on this slide is that the fact that stillbirth is the loss of a baby after 20 weeks of pregnancy, which is obviously what we're talking about today. But I really wanted to draw your attention to the fact that on average, we lose around 23,500 babies every year to stillbirth in the United States, compared to infant mortality, which is we lose around 22,000 infants every year in the United States. And that's not to underscore the devastation and tragedy that infant mortality is and has on the society. But what I want to do is shine a light on the fact that we are not talking about stillbirth like we're talking about infant mortality. We're not talking about stillbirth and stillbirth prevention like we talk about the Back to Sleep campaign, or, you know, sleeping in the same room until 6 months in the crib and not smoking around baby. So what I want to do today is give you the tools and resources to feel confident and comfortable talking about stillbirth and stillbirth prevention with your patients. I want to give you the tools and resources to be able to know about an evidence-based tool that you can share with them that's empowering and that really helps shine a light on stillbirth so we can change these numbers that I'm about to share with you. I think people think a lot of times that stillbirth is not as common as people think, or it was something from our great-grandparents' era, but really stillbirth is a lot more common than people think. 1 in every 169 pregnancies ends in stillbirth. And the racial disparities are alarming and persistent. So Black women and Black expectant parents are 2 times, sometimes 3 times more likely to experience a stillbirth over their white counterpart. Hispanic expectant parents, it's 1 in every 199 pregnancies will end in a stillbirth. Indigenous, 1 in every 138. White expectant parents, 1 in every 204. Asian Pacific Islanders, 1 in every 233. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. We lose 65 babies a day in the US to stillbirth, 65 babies a day. We should be talking about this. That is like a busload of kindergartners. We need to be talking about this, and we have the tools and resources to help prevent preventable stillbirths. So if we look at Michigan data specifically, and we're really focused on 14 counties with MiHIA and Covenant, but I did have to pull the Michigan data as a state. So your 2020 Michigan data, your total stillbirth rate is 5.7 deaths per 1,000 live births. And you can see the breakdowns by race: white, Black. Black is almost double the white rate. American Indian, 2.3. Asian Pacific Islanders, 4.8. Hispanic, 3.7. And so if we look at that chart there, that graph with the teal, the red, and the yellow lines, Michigan, you've had a slight increase there the last couple of years. And so what we want to do is we want to make sure that you're coming down to the yellow line. That's where we are. And so that's our goal, right? Like that's why we're here. And I'll talk about that 32% reduction that we've had in Iowa. And that's what we want to see happen in Michigan, or more. Like we would love if I was out of a job, right? Like that's my goal, that we can prevent all preventable stillbirths through the importance of fetal movement monitoring, and now I'm out of a job. So on average, Michigan loses around 622 babies every year to stillbirth. If we replicate the success we've seen in Iowa with that 32% reduction, we could save potentially 199 babies every year with this campaign. And if we look at the 14 county service area specifically for MiHIA, you're losing around 25 babies a year to stillbirth just in that region. So we have some work to do. And that's why I'm so happy to see so many people on to share this information with, to change that. Because what we want to do is we want to get you here. We want to get you to this dashed line, this downward trend, not this, if you put a trend line on your red line, it would be going up, right? We want to get down. So when I talk about a 32% reduction in Iowa, what I'm talking about is this. We launched Count the Kicks in 2008, and I'll talk about our founding here in a little bit. In the first 5 years of the campaign, we saw a 39% reduction in the number of stillbirths here among African-American women. And in the 10 years, 2008 to 2018, we had a 32% reduction in the number of stillbirths. And public health officials have said, there really wasn't anything else going on in Iowa that would have made such an impact. It's not like every expectant parent received doula care, which we know would have a huge positive impact. It's not like obesity rates decreased, or things like that are risk factors to stillbirth. In fact, those are increased. So even though we have all these risk factors increasing, our stillbirth rate is decreasing. And one of the things that public health officials have said is it's really because of the inception of Count the Kicks. Now, we're doing additional research on this. We have a prominent stillbirth researcher out of the United Kingdom who's an internationally well-renowned stillbirth researcher who's truly looking at this data to say that, yes, there was nothing else happening in Iowa that made such an impact other than the inception of Count the Kicks and the materials going out and the social media messages, the Good Morning America video, that storytelling. And so that research is going to come out here in the next couple weeks or months. So we'll be sure to share that and include it and share it with our partners so you can all see that research. But this, in a nutshell, this is what I want to see happen in Michigan. And I know this is what MiHIA and Covenant want to see, and that's why we're here. So when we talk about such large disparities for stillbirth, I think it's so important to take a moment and really talk about why. Why are there such large disparities and what can we do about it? What is Count the Kicks doing about it? And then think through, what can you do about it? So that's what I want you to think through as we go through these next few slides. So research points to the following as causes for these disparities. Things like systemic racism, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society, and all that comes with it has led to real and pervasive health issues for Black women. Epigenetics, predisposition to certain conditions, access to healthcare, socioeconomic barriers. But research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So here are some of the things that we're doing to reduce these disparities that exist and persist in stillbirth, and what are some things that you could do? So we have an app in 14 languages, trying to be as inclusive as possible. We're adding 2 additional languages that will come out in the next week or so, Portuguese and Hebrew. We have culturally appropriate educational material. Is the material you use culturally appropriate? We have videos, printed educational materials, and FAQs in multiple languages. We now have a health equity director and coordinator who are routinely and continually looking at our messaging, looking at our materials, working with different agencies, working within marginalized communities to make sure that we continue to remain culturally competent. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. And it's not just one implicit bias training, it's a continual process of education and learning. We're improving programming based on lived experiences shared by people of color. We've done focus groups and community conversations. And, you know, some of the work that we've done has led us to improve our programming. So we're working outside typical healthcare settings. We're working within the faith community. We're working within libraries and hairdressers and sharing and educating those individuals about this. So those are just some of the things that we're doing that I think you could also kind of mirror. And I'd love to learn more about what you're doing as well. So we know about the data, we know about how prevalent stillbirth is, and we know that 65 babies a day die every day in the US. But what about the research and evidence behind Count the Kicks? I think that's one of my top questions I always get. So I always like to add a couple slides here about some of the research, and I'll be adding to this as we get more and more of our research that we're doing, like I mentioned with Dr. Hiesel from the UK. But this one in particular, I like to share. And if you've seen my presentation before, you know this, but if you haven't, I really, really recommend that you read this journal article. And this is on our website. We have a whole page dedicated to evidence, and we know how important it is. But this one in particular, I like to showcase because this is the one that started it all. And what I mean by that is Count the Kicks was actually created and founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time of their loss. They got connected through pastors, they got connected through friends. And as they kind of sat together and met for coffee and were grieving and talking, and what they realized was, oh my goodness, we all had very similar stories, and yet we were told this isn't that common, but here we all sit, right? This has got to be more common than people talk about. I know one of the founders was told it was like getting struck by lightning. No, it's way more common than that. I had another individual tell me their doctor said it was like winning the lottery if the lottery was a bad outcome. I just can't even imagine, right? So anyways, these women got together, and long story short, they one of the founders was a state representative at the time, worked with Senator Tom Harkin, one of the authors of the ADA, American Disabilities Act. And what they did is they got some funding from CDC to create the first stillbirth registry in the nation, a way to track trends in stillbirth. And it was because of this funding that some of the founders went to speak and listen at a public health conference. And while they were at this public health conference listening and learning, they heard about this study out of Norway, which is the one you see on your screen there in the box, where out of this study, what they found was when expectant parents were educated through like a pamphlet and education from their providers on the importance of tracking fetal movement in the third trimester, this cohort of women that were educated on this, the stillbirth rate decreased about 30% among this cohort. And so some of the founders listening to this said, oh my goodness, like that's amazing. Like Kit County's been around for a long time, but the tools and resources to be able to talk about it with parents, to know what's normal for your baby and to speak up if there's a change, to have those tools and resources, that's what we can create. We can come back, if we can just save one baby, it'll all be worth it. And here we are over a decade later, saving hundreds of babies, countless families, and their dream was to save one. I mean, that's it. And so they came back to Iowa. They worked with Iowa Department of Public Health. They looked at other research and found and created this very uplifting, empowering campaign, bright, colorful Count the Kicks campaign. And so Dr. Ruth Fretz, who I highlight here, she was the only United States researcher on this Norway study. She's also now part of our medical advisory board. And she said, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern, and that's key, and I'll talk about that here in a minute, their normal movement patterns starting at 28 weeks, and to speak up if they notice a change. I think the top question I get a lot of times at conferences or doing this presentation is this going to increase anxiety? Or I'm worried that I'm going to have all these expectant parents call me because they're nervous about their baby's movements. And I understand your concern, but I want to alleviate that. So Kit County does not increase anxiety in most pregnant women. Here's another research study that stated one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to the pregnant woman and prevents unnecessary visits. And I'll explain that in just a minute. We've also done our own study on our app users, thousands of app users through the Des Moines University and the Harkin Institute, and they found that 84% of app users stated that regular tracking, that's important, was associated with feelings of bonding, and 77% of app users reported feeling less anxious. The researchers also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. Because what you have now is you have a highly educated individual that understands what's normal for her baby. She has data in her hands. If they're using the app or a paper kit counting charts, they're checking around the same time every day. They start to see that trend for their baby. So now they have data. They know when to speak up, if they need to speak up, and how to speak up. I think there's other added benefits that we don't think about. And I think that there's this sometimes common misconception that you're going to have reduced fetal movement and it's automatically emergency C-section, right? Like, I think that's, we as humans, I think we kind of go to that extreme case scenario all the time, but there's other benefits. It's not like you go in and you automatically have a C-section. Remember, this is a non-invasive way to check on baby. You're working with your care team to go through next steps to make sure baby's okay, to make sure mom's okay. We know that fetal movement monitoring can help reduce preterm birth rate. We know that fetal growth restrictions are identified earlier. We also know that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have had live births, regardless of the cause of fetal death. They're 4 times more likely to experience to die if you have a stillbirth. So due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So that connection between maternal mortality and stillbirth, in April of this year, we worked with the Harkin Institute and researchers to publish this white paper that does show the link between stillbirth and maternal mortality and morbidity. It also includes these firsthand accounts from women who shared how speaking up about a change in their baby's movements not only helped save their baby, but also addressed and they found pregnancy complications that really put their own life at risk. So you don't need to write down this link or anything. I'll send this out afterwards. But the the connection is there. They're intrinsically connected. So if you think about it, we have an opportunity to not just save baby's life potentially, but also the expectant parent's life. So we really have a great tool here that I think is necessary and should be part of everybody's practice outreach when you're working with expectant parents. And it's so simple and easy to use. So now you know about the research and evidence. You know it's an evidence-based stillbirth prevention campaign. You know that it's an early warning system for expectant parents. We're going to get into talking about how we're educating birthing people on the importance of tracking fetal movement and how you do that through our app or paper charts. And you know that this is empowering, right? It's bright, it's colorful. The founders really wanted to make sure that they created something empowering because they firsthand know how devastating a stillbirth is. So something empowering. So let's get into the app, why this is so important, and how to talk about this with your expectant parents. So why are movements so important? Because remember, movement is one very important way a baby communicates before birth. And we know, and research shows, a change in baby's movements can be an early sign. Sometimes it's the only warning sign that baby may give when they're in distress. So when should you be talking about this with your expectant parents? And you could talk about this if you're a WIC consultant, if you are a home visitor, if you are a nurse, if you're an OBGYN listening in today. I want you to start talking about this at the 3rd trimester. If you see somebody not as often, like maybe you see somebody like your WIC consultant, you might see them at 24 weeks and then not again until 32 weeks. Make sure that you are talking to them about this. Before that, hand them the brochure and say, hey, I want you to download this app between now and when I see you next. I want you to start using it when you hit the 3rd trimester, right? So let's go ahead and have that conversation now. So think through again, that workflow of how that can be integrated into your system. The reason why we do this around the 3rd trimester is because that's when research has established that there's a consistent pattern that we can feel and track. And so when you talk to your parents about kick counting and count the kicks, there's that common, okay, it's just a kick, right? Well, it's any roll, kick, jab, push, anything except hiccups. We get that question a lot. Hiccups, especially from expectant parents, hiccups are involuntary, so they don't count towards the movement, but it's any other movement. So when you're talking to your expectant parents, it's simple and easy to talk through. And this is how they can be in tune with their baby and their body. And so what you want to do is starting at the 3rd trimester, this is a cute little pamphlet that we have, or printable, I guess, that you can utilize, but you want to track your baby's movements with a free app, which we'll talk about in a second, or they can use kick counting charts, which we also have available for free on our website. And what you want to do is you want to explain to them that you want them to count daily, preferably at the same time every day. And this is really important, and I will stress it multiple times. I want you to do that because that's how they're going to understand the pattern during that time. If they're counting or, at 5 o'clock and then 2 o'clock and then 1 o'clock, like all over the board, they're going to get kind of that inconsistent pattern. So choose a time when baby's most active, so that they can figure out that baby's pattern during that time. And the app will help with that. After they start noticing that pattern, they start tracking for a couple of days, the app especially will start to show them that pattern, that trend, but they can see that on paper too. And then we want them to continue tracking every day. You want to really encourage them. If you're their provider, say, I want to hear from you. Like, I'm here for you, call me. If you can't get a hold of me, go into your nearest, birthing center. If you're not their provider and you're talking to them about this, encourage them to share this with their provider. Encourage them to say, if you have questions, contact your provider. I think there's this common idea that as, expectant parents and things, and I know this, I felt, I've had 3 babies where it's like, I don't want to bother anybody, right? I don't want to bother anybody, but why? Like, if you have concerns, no matter if it's fetal movement monitoring, bleeding, whatever it is, call or go in. That hours and minutes matter. So now what I'd love for you to do, because we're in the United States and we can multitask, that's literally what we live and breathe on. I'd love for you to take out your phone and search Count the Kicks in your app store while I'm talking through the app and download it, because I want you to have it on your phone so you can see how easy this is to use. I want you to use it. I want you to practice with it. I want you to pull it out when you're talking to your expectant parents and say, look how easy this is. And so while you're doing that, I'm going to talk, because I know we can do both, but this is how it works. You pick a time each day around the same time. You sit down, you focus on baby. Maybe you're including siblings and you say, come on, I have a 4-year-old named Ryder. Come on, Ryder, we're going to read to baby and count baby's kicks. So let's get over here and do that. So we sit down together, include them, include significant others. And I feel that first movement that I want to start with. So I tap that footprint that you see there on the screen on the right-hand side. So every time I feel a footprint, I tap, or feel a movement, I tap the footprint, and the timer starts until I get to 10. Once I get to 10, the timer stops. And then what it does is it actually asks how baby's strength was. So if you think back to that video from baby Ruby's mom, when her mom said her movements just felt softer, they felt weaker. So what research also says is not only should we be paying attention to how long it takes baby to get to 10 movements, but the strength of those movements. And so what we did is we worked with researchers, we worked with providers to create a way to track the strength of those movements during those sessions. And so after you're done counting and you tap that footprint, you get asked to rate between 1 through 5 the strength of those movements. And so what happens is you get this bar graph for the strength, and then you also get this line graph for the movements. So at the very end of your session, you can start to see after a couple sessions how baby's been moving. So this example here, that big picture where you see total time is 15 minutes and 6 seconds. The average time was 15 minutes and 24 seconds. So you can visually see that baby takes on average around 15 minutes. So if one day I'm counting and all of a sudden it takes, I don't know, an hour and 15 minutes, that graph is going to spike up, which is gonna, like the other image you see there, which is going to indicate to me that that's not my baby's normal, right? My baby's normal has been 15 minutes for the last 2 weeks or 3 weeks, however long I've been counting. So I'm going to call my provider and talk to them and see what they want me to do. If I can't get a hold of my provider, I'm going to go in and get checked out. And then the bar graph, the strength. I'm not saying that if your movement increases and your strength decreases, that will always happen together. I'm just saying that the app is very visual. So whether one of these changes or both of them change at the same time, go in and go to your provider and get checked out. So a couple other features that I wanted to highlight is the fact that there's the 14 languages. If you work with a demographic and you need a different language, let me know, because we want to make sure we're meeting your needs, and we can find grant funding. We can work with MiHIA and Covenant. We'll figure it out how we can get that language on the app for you and for the population you serve. We will be adding Portuguese and Hebrew here, like I said earlier. It's completely free. There are no ads. The only pop-up is after they start counting is a daily message that we can control, and it's educational. You can track the strength. You can restart your session or delete a kick. So I'm counting next to my 4-year-old and he grabs my phone and starts tapping. That's going to skew my results. So I'm going to delete those kicks because they didn't count. You can review your kick counting history. And then most importantly, you can download your history and share it with your provider. So you can have data in your hands to say, look how my baby's been moving. I want to talk about this, or I have concerns. This is not my baby's normal movement pattern. You can count for single babies or twins. You can track future pregnancies. I highly, highly recommend when you're talking about this with your parents and you're going through the app and the features, have them set up reminders in the app. That's really, really important. It's really important that we don't just count when we think movement's off or we count every other day. Research shows we need to count daily so we can really understand the pattern and trend of those movements. So have them set daily reminders in the app, and then they don't have to do it outside their calendar. And then they get fun push notifications like, hey, it's time to count your little kicker, that type of thing. It's available on the Apple smartwatch. You can manage multiple devices. You could be counting on your watch one day and your iPad the next day. And soon, what's not on here, and if you've listened to this before, this is brand new information for you all, and you're one of the first to learn about it. We have a web-based kick counter that will be coming out soon. So look for that in our newsletter or on social media. And what we really hope for that is for individuals that would rather count like at a desktop, or maybe they don't always have Wi-Fi and they can't use the app to get their data to sync. So they can go to a library or a friend's house, or maybe their time to count is during a 10-minute break at 2 o'clock in the afternoon at their work, and they can't pull out their phone because it's in a locker or their drawer or something like that. So look for that to come out. There'll be a web-based kick counter and it's all going to sync to the app. So it's all connected. We also released this resource where individuals can click on the resources section on the app and go to find resources, find help, and they can enter their zip code, like I entered mine here, and find free or reduced cost resources that they might need help accessing. Maybe they need childcare assistance. Maybe they need Section 8 housing assistance. They can search that and find it within their zip code. So it's very localized. So this is a great resource. What we want to do is we already have an audience prenatally, right? So if we can connect them with their basic needs and impact social determinants of health in a positive way, we want to do that. We want to make sure that they can access resources. And so the chance of that baby experiencing adverse childhood experiences can decrease dramatically if we can get people connected prenatally versus 2 weeks postpartum and your milk is coming in and you don't know what to do and things like that. So this is a free resource for anybody. And then here's the app in action. So let's watch. And this is a great video. This is on the app. We have some videos on the app, not all of our videos, but this is a great one to share with your parents.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So she said 12 languages because we shot that PSA and added 2 more languages. So and then we're going to add 2 more. So it's 12 plus, basically, more than 12. The other thing that I wanted to add that's newer, if you're had this presentation before, is we survey our app users every quarter. And in our spring 2020 app user survey, individuals were asked, what kind of messages would influence you to speak up if you notice a change in your baby's movements? And 87% of our app users said that they would contact their provider about a change in their baby's movements if their healthcare provider encouraged them to speak up about a change in movement. So I cannot stress enough the important role you all play as a provider on your expectant parents, that they need to learn and know that you want them to be doing this. If you're not their provider, you're a home visitor, you're a WIC consultant, encourage them to talk to their providers about this, because that's really, really important. And I can't stress enough either how important touch points are. So if you're talking about it as a WIC consultant, then they're going to their OBGYN and they see a brochure and they're talked about it there. And then they go to their family practice or their pediatrician for their child and they see a brochure. That's 3 touch points right there. And then they see social media ad through MiHIA. Like, It's so important to have all those different methods so it sticks with us and it ingrains in us of what we want to do. I think it's also really important to know that what you're doing and what you're taking today and taking with you when you talk about Count the Kicks and stillbirth prevention is you're increasing their health literacy. And individuals' health literacy is one of the strongest indicators of their health status. So you're taking these tips and you're having this healthy dialogue. You're being equitable. You're avoiding assumptions, and you're providing this to every single expectant parent, no matter their race, their gender, their religion, their socioeconomic status. You're giving them the same information and interaction every single time you see them. You're listening and you're learning, and you're asking strategic and open-ended questions about kick counting. You're assessing what the individual already understands, feels, and desires. You're using questions like, tell me what you know about fetal movement monitoring or baby's movements. Let's talk about this. What questions do you have? You're being clear and you're concise. You're avoiding long or complex explanations. So I just use medical terminology, right? Like I said, fetal movement monitoring. You wouldn't do that with the patient, right? Your baby's movements. You're considering everyday vocabulary. You're being honest, right? I think there's this idea that expectant parents, we're delicate flowers and we can't be told certain things, but we're told all sorts of things. And I'll talk about that in a minute when you're talking to how to talk to expectant parents about this, but speak the truth, right? You're practicing empathy and compassion. You're all in this field for a reason. But we can talk about stillbirth and stillbirth prevention, and it's okay. And we need to talk about it. And then you're reteaching. This is why it's so important to talk about every single time you see them. If they're seem confused or they have a lack of understanding, make sure that you're correcting and clarifying. You're providing that extra support to those who need it. So definitely talk about it every single time you see them in the third trimester. So maybe you're thinking you don't want to scare individuals, you don't want to scare expectant parents. Again, we know this, you know this, pregnancy is full of risks that we talk to people about, and stillbirth is another risk we deserve to be educated on. Stillbirth just happens, there's nothing we can do. That's not right. There's warning signs if we know what to look for, and a change in baby's movements is one of the earliest warning signs. What about my baby's always active? I guarantee you, when you start talking about this, you're going to have your parents say, oh, I don't need to do that. It's like a jungle gym in there. And I get it. I've had 3 kids. 2 of mine it was like my uterus was a trampoline. But babies are active until they aren't. And I say the same thing when I get this feedback, when I'm talking to my friends about this, or my pregnant individuals, and I say, that's awesome. An active baby is a healthy baby, but it's still really important to know if your normally active baby has slowed down. It takes the guesswork out of knowing that, right? If you know what's normal for your baby, you don't have to sit there and think, is it 5 minutes? Or is it 20 minutes? Or is it 25 minutes? Or is it 10 minutes? I don't know. You have the app to help with that. Or how about they're almost at their due date, right? But the risk of stillbirth increases, and increases quite a bit as somebody approaches or exceeds their due date. Some other common myths that you might get and interact, we talked about the active one. This will be in the slide deck because it's so common. What about only telling expectant parents that are high risk about this? We want every single expectant parent to know about this. You should be talking about this with everybody the same way every time. 10 and 2, I hear this one a lot. I was told 10 and 2. I was told 10 kicks in 1 hour, I've heard. Again, every baby's different. The recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates moms should work to understand the normal amount of time each day it takes baby to get to 10 movements. And I'll tell you why. There's a research study on this too on our evidence page. But basically what it says in a nutshell is, as humans, we focus on time. You know, you have an hour with me. I have about 15 minutes left. I'm focused on that. I have to get through these next few slides in about 15 minutes. That's my goal, right? So when we say things like 10 and 2 or 10 and 1, what happens then, you potentially have an expectant parent who's been counting routinely, counting daily like they should for the past 2 weeks, and they've been getting their 10 movements in 15 minutes. And all of a sudden they count and they get 10 movements in an hour and 15 minutes. And they think to themselves, well, that's okay because I got it within 2 hours. But that's not my baby's normal, right? My baby's normal for the last 2 or 3 weeks has been 15 minutes. not an hour and 15 minutes. So I want to know what's normal for my baby, and I'm going to speak up to my provider if that changes. What about a Doppler device? I know there's apps out there that you can get. I think as, non-medical individuals, we think, hearing the heartbeat, that's awesome. And it's always exciting when you go to those appointments. But what we don't know is that a change of baby's heartbeat is one of the last things to occur. So we do not want people using a Doppler device. And even if you're a medical provider, you don't just have somebody come in with a change in fetal movement and only do a Doppler device, right? Like you're having additional tests done. Plus the fact that it can be hard to find, and then you might mistake your own heartbeat for the baby's heartbeat, that type of thing. Here's another common one that I get asked about a lot, or we get asked about, or people ask us about. So if my baby's not moving, so I'm going to drink Mountain Dew, or I'm going to eat a Snickers bar, or I'm going to jump up and down, I've heard. So research has moved away from this idea that sugary drinks and, food are a good way to get baby to move, because if kick counts are best monitored without interventions like juice and candy. Because if baby's not moving like normal, we should be speaking up to our providers right away. It's just like when you and I are sick. If we're sick, we are resting, we're not doing much, we're conserving our energy. Same with baby in utero. If something's going on with baby, whether it's an infection, umbilical cord, low amniotic fluid, hemorrhage, whatever it is, they're not moving, right? Or maybe they couldn't move. Maybe their cord's in the way or something. So why are we trying to force baby to move if it's not their normal movement pattern? So we want to move away from that. This is kind of an old wives' tale, right? They don't move as much, but we know this, this, babies move up to and during labor. The movements just kind of change, right? Like it's less of those fewer body rolls and more of those jabs to the bladder and the ribs and things like that. But again, if they have been tracking their baby's movements, they should still get the same amount of movements in the same amount of time. I don't know if I have any triage individuals on here. I love labor and delivery triage. I went there several times with my daughter. I went there because I did not know her normal. I did not know about tracking. She was born before the app. I went because I was comparing her to my previous pregnancy, where I would get 10 movements in 5 minutes. And she took about 35 minutes when I was counting. And so I went 3 times. That's the perfect opportunity. I got checked out. Everything was fine. She's now 7, moves all the time. But that's a great opportunity for labor and delivery to say, hey, here's a brochure, download the app, track your baby's normal, and then you'll understand what her normal is. So if you work in labor and delivery, or somebody that does, or you can share this at a coalition meeting, please, please, please have them add this to their discharge paperwork, have them put up the posters and the brochures. And then, of course, we want to continue dental care. I think there's a common misconception that we can't have dental care during pregnancy, but that's really, really important. So some other systems change, and hopefully you've been thinking through this a little bit with your workflow. Like I said, whether you're a nurse, you're a WIC clinic, or whatever, that you could you add this to your discharge paperwork? Could you have all your front desk staff trained? So if somebody calls with reduced fetal movement, your protocol is they automatically talk to a nurse or provider. They're not leaving a message, they're not leaving a voicemail, they're getting through to somebody. If you're a home visitor or somebody that does family care plans or intake forms, and you find out they mark that they're pregnant and they're 12 weeks along, can you put a flag in your calendar or your team's calendar to say, we want to talk to Megan at 28 weeks when we see her about count the kicks? What about your glucose test? In Iowa, with my glucose test, I always had to drink it in front of somebody there at the clinic, and then I had to get my blood drawn and wait there for an hour and then get my blood drawn again. That would have been a perfect opportunity to hand me a brochure and say, read this, download the app, we'll talk about count the kicks. My favorite is including it in your EHR, EMR records. So if you want to do this and we have gold standard paperwork that you can use for your discharge papers, reach out to me, because it is one of my favorite things to do. You can make this easy, right? So you can make this common practice so you don't have to think about it and it just comes natural. You could add a phone recording to your message as people are waiting about 3rd trimester. We have PSAs like, contact me, I'm here to help you. So we're wrapping up here soon, but this is one of my favorite parts. And I am actually going to play a little bit of music because we have this and a couple more slides, but I want you to take a moment. I want you to scan this QR code, and I want you to go and click on order materials and click on Michigan and fill your shopping cart. And I want you to order materials, and we're going to come back. So don't go anywhere, just do that. And then you'll be entered to win a gift card again. So you get entered to win a gift card for attending and potentially entered to win a gift card for ordering. So let's listen to Pharrell Williams for a second and then come back and I'll give you time to do that.
I could go to space with the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do.
So keep ordering. We're good multitaskers, right? But I want to keep going so we can get done on time because I know I'm cognizant of that. So you can order the promo posters, the how-to posters, which you see on your screen here in English and Spanish, app reminder cards, brochures, and it's completely free because of this awesome partnership with MiHIA and Covenant. So please take advantage of this. They removed that cost barrier, that barrier is a cost. So this is exactly what we want you to use. We want you to use these pieces. And then this is the online training I was talking about. You don't need to write down this code. I'll send it to you. But click on the link when you get it, and you can share this with your team. You can share this with your providers, and use this code, save babies -MI, and you can take it for free. Again, because of this relationship with MiHIA and Covenant. Like, I can't underscore enough or talk about enough the importance of partnerships and collaboration, because like I said, it's not me that's talking to expectant parents about this. It's you taking this information and putting these up. You're making the difference. You're saving babies in your community. We have a lot of other great resources online too. We have a parent academy that you could send people with digital tools. We have a provider academy. We have our kit counting charts, and actually we have those in English, Spanish, Haitian Creole, and soon to be Portuguese, and we have videos. So please take advantage of all of that information. And then, so your final next steps are become familiar with the app, which you already have, your ordering materials. Awesome. This takes 3 to 5 minutes. This is not something that will take your whole 15-minute appointment time. If you're a provider, this is something simple and easy to do, but I cannot stress enough the importance of you as a provider telling your patient you want to hear from them, or you as an individual talking to your expectant parent saying every single time you see them, let's talk about your baby's movements, show me your graph. Make sure your entire team knows about this, share this recording, go online and take the training, use your EHR, like use your intake forms, use pieces that you already have in place to make this easier. And then remember, hours and minutes matter. So if you are, especially if you're in a rural area and you work with a lot of rural individuals where they might have a 60-minute drive to the nearest birthing center, we can't have them wait until the next day for their family care clinic to open up, right? Like, we need to get them going to their provider right away if they notice a concern. So make sure that they know that. And then this is why we do this, right? These beautiful, beautiful baby faces that you see on the screen. And we have over 100 that we know about. We know there's more out there. These are just the ones that have contacted us. And this is why we do this, so we can save more babies like Nala. So let's watch.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself, don't feel bad or stupid, don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life.
So I love what Dana, her mom, said. Oops, I'm trying to turn my video back on so you guys can see me. I love what she says at the end where she's like, don't worry about the bills, don't worry about this, go check on your baby. I mean, that's really key, right? What we've kind of talked about this whole time. So that's it for me. Connect with us, follow us on social media. You can reshare all of our stuff on social media. MiHIA does an awesome job of sharing our stuff. You can share their information, sign up for our newsletter so you know when the web-based kick counter comes out and all these other great ideas and things that are happening when we have baby safe stories. I'm happy to stay on and answer any questions that you may have. I'll check the chat here. I'll put my email in too, because I realized I didn't have that. So my apologies, but we want to do this with you and we need you. So please take this information, and thank you to MiHIA and Covenant for believing in us and sharing this with your location and your area so we can get more babies here Earthside. So thank you for giving me an hour of your time today. I truly, truly appreciate it. I'm going to just put my contact information in the chat, and then you're free to go or free to stay on for a couple more minutes and ask me questions, but you're muted, so you do have to raise your hand or ask in the chat. And again, just as follow-up, you'll get a PDF of the slide deck. You'll get some of the links we talked about today, and you'll get the recording, and then I'll do the drawing for the gift cards. So thank you all so much.